Hello, everyone, and welcome to one more episode of MetaCast, the podcast of the Meta-Analysis Academy. In this podcast, we discuss successful careers. We bring people on who've been extraordinarily successful for their stage of training or in their careers as a whole. And today, we have the wonderful opportunity of welcoming to the stage Dr. Javed Sheikh, who's from India, from Mumbai, is currently a fellow in radiology at Brigham Women's Hospital here in Boston. He's going to share with us his journey, and also we're going to talk a lot about the alternative pathway. This is a common pathway for doctors who are already trained in radiology in another country to come to the United States, get additional training, and then work here as fully licensed radiologists. And we're also going to talk about many things that may interest you, even though you're not a radiologist. We're going to talk about coming to the United States, the challenges, taking the USMLEs after you've already done, training elsewhere. So we're going to learn a lot from Javed here. Javed, thank you so much for joining. It's such an honor for me to welcome you here to the MetaCast.
Thank you, Dr. Cardoso, for inviting me.
Absolutely. Can you start with a quick introduction, just saying a little bit about yourself and where you're from?
Hi, I'm Dr. Mohammed Javed Sheikh. I'm a clinical fellow at Brigham and Women's Hospital. I'm doing multiple fellowships here. My first fellowship, which I completed, was cancer imaging. Currently, I'm doing non-invasive cardiovascular imaging. For my next year, I'm doing abdominal imaging and intervention.
That's actually how I had the honor of meeting Javed, is because we work together in non-invasive cardiovascular imaging. Now, an important disclosure here, what we discussed today is in no way affiliated with the institutions where we work, with our employers. The views expressed here are exclusively our own and do not necessarily reflect the opinions of our employers. I also have an important invitation for you. If you don't know our program yet, make sure to check out the Meta-Analysis Academy, where I teach you how to do impactful research with autonomy by doing systematic reviews and meta-analysis to advance your career. Javed, so great to have you on. Let's jump right into it. Let's talk about the alternative pathway. I know a lot of cardiologists and other specialists and from other countries in the world who would love to have an opportunity like radiology offers you guys, which is to use the residency training that you've had in your country, and then keep that and not have to repeat residency, but then just jump into a fellowship. But unfortunately, that's not widely available for cardiology, for oncology, for gastroenterology, for surgical specialties, but it is for radiology. So walk us through, what is the alternative pathway?
Yeah. So that's a very good question. As you said, that this pathway is not available for other specialties, but it's more so for radiology. The reason being that there is a market shortage of radiologists in the US, and there are unfilled spots in the fellowships, So the international medical graduates who have prior radiology residency training in their home country, they are like really good candidates to fill in these spots and get like specialized training. Now, what is this alternate pathway all about? It's like the radiology residency in the US is of 5 years. The first year is the internship, the PGY1, and the PGY2 to PGY5 is the radiology residency. So what this alternate pathway allows us is that it allows us to supplement the 4-year training. Instead of a residency, you can do it as a fellow or an attending, but you have to supplement that 4 years of training. Only after that you become eligible to sit for the boards.
That's amazing. That's really great. So you've done the residency in another country, and then you come here and you do 4 years of additional training.
Yes.
Are there any specific rules as to like what type of fellowships you can do? Yeah, go ahead and tell us more about the rules.
That's a very good question. So it is 4 years of training. You can do 4 different fellowships, or you can do like 1 or 2 years of fellowship, and if the institute allows you to become an attending, you can do the remaining years as an attending. So, but the point is that you have to complete all the 4 years of training within the span of 8 years. So that is the first thing. So you can do like 2 years of fellowship, take a break, and then come back and do the 2 years. But all the 4 years should be within the span of 8 years.
And they also have to be in the same institution.
It has to be in an institute which has an accredited radiology residency training.
But it also has to be within the same. You can't do part in one or in part in another.
Yes. So it has to be in the same institute and the institute should have an accredited radiology residency
see.
training.
Gotcha.
If the institute offers a fellowship but does not have an accredited radiology residency, then the 4-year pathway cannot be done.
So because it has to be 4 different years or 4 years, and most people end up doing training in different specialties, I imagine that it would be more advantageous for applicants to go to massive institutions, to big institutions, like, for example, here in Boston, there's a few, where you could rotate around different specialties in that same institution. Is that right?
Yes. So these 4 years, of like specialized training really helps us, in carving a career in the US. And not only that, but when we look for jobs, we have like more number of options because we have different fellowships. So we are eligible to apply for more jobs as a specialist than one.
That's a great point you bring up. I really want to emphasize this because let's say, for example, someone is a cardiologist. Let's just use that. This person has typically done 4 years of residency in their home country. Like in Brazil, you would have had to do 2 years of internal medicine, 2 years of cardiology. If you come to the United States and want to be a cardiologist, you have to repeat cardiology training. So it's 3 years of internal medicine, 3 years of cardiology. With radiology, you also have to do additional training, like we said, 4 years. But the key difference is that it's a fellowship. So you're actually getting more training. You're becoming a specialist in multiple different areas. And then when you apply for a job, not only now you can get a full license as a radiologist, but now you also have all these different trainings, right?
Yes. And also so there are mainly like 2 kinds of jobs, academic one and the private one. So for the private jobs, the more fellowship you have, the better it is. Even for the academic ones, most of the institutes, they prefer you to be a specialist, like committed to only one discipline. But because radiologists want to do like multiple things at the same time, so many hospitals, they allow us to do 2 practices, like 2 weeks of non-invasive cardiovascular imaging, 2 weeks of thoracic imaging. So you have that option that you can continue to practice more than one fellowships as an attending in an academic.
Great. And then if someone is listening and they're in India or Brazil or Colombia, somewhere else, and they're a radiologist or they're currently a radiology resident, how do they find these positions? How did you find the position here specifically, for example?
That is again a very good question. So there are multiple institutes which offer the alternate pathway. And if we search it online, we come to know about some of the hospitals. I can enumerate a bunch of them in Boston, in Massachusetts. Similar to that, you have like many hospitals all across the US which offer, these kind of pathways for international medical graduates. They can be competitive at times. And also some of the fellowships are considered more competitive than the other fellowships, like for example, abdominal imaging, neuroimaging, and in general, all ACGME fellowships, they are considered to be more competitive. So to getting into those fellowships is like definitely more difficult than to get into fellowships which are non-ACGME or less competitive fellowships. So most of the international medical graduates who are doing the alternate pathway, they come into the less competitive programs, for the first 1 or 2 years. And then they make their, networking, and they prove their mettle, with the hard work. They network, they do projects with, other departments. And that is how they get ACGME fellowships also. In the US, most of the, only few of these states require 2 years of ACGME to get license. Some of the states require 1. And there are many states which don't even require an ACGME fellowship. So you can actually do like 4 years of non-ACGME and still become an attending. And you can do 1 or 2 years of ACGME and become an attending.
Great. Can you? That's a great explanation. Can you explain to the folks what are ACGME fellowships and non-ACGME fellowships?
Yeah.
Many people may not be familiar with that concept.
So most of the neuroimaging fellowships and abdominal imaging fellowships, they are ACGME accredited fellowships. Some of the breast imaging and musculoskeletal imaging are ACGME accredited. And now coming to which are non-ACGME, like cancer imaging, non-invasive cardiovascular imaging, thoracic imaging, pediatric imaging, pediatric neuroimaging. Most of these fellowships are non-ACGME. But having said that, in the long run, being ACGME or non-ACGME does not make any difference. The pay scale of an attending who is doing abdominal or somebody who is doing cancer imaging or thoracic imaging is not substantially different. So it really does not matter in the long run. And when it comes to the licensing, some of the state medical boards require at least 1 or 2 years of ACGME training, but that can easily be bypassed if we get recommendation letters from the institute where we did our fellowship, and the licensing part can easily be bypassed.
So at the end of the day, it doesn't make a whole lot of difference.
It does not make a lot of difference in the long run.
So ACGME, I'm not entirely sure what it means, but it might be American College of Graduate
it's Accredited Council of Graduate Medical Education, which has like a lot of regulatory guidelines as to how many hours of work in a week. And you have dedicated academic time. You have, dedicated.
So they set rules.
ACGME has a lot of protected hours for research, for academics. The working hours are more fixed in ACGME fellowships.
That's fantastic. So one point that Javed mentioned that I want to highlight is ultimately, if you're applying for these fellowships, whether it's ACGME accredited or not is not really what's important. But what is important is what specialty you're actually getting the training in. You may be really interested in neuroradiology. You may be really interested in abdominal radiology. So one thing that he said that it's important to highlight is that if you're interested in the more competitive specialties, one way to do it would be to get your foot in the door, start with a less competitive specialty, and then make your way up, networking, maybe publishing, maybe doing research, or just doing a really good job as a fellow, getting your attending in the less competitive fellowship to give a call to the program director of the more competitive fellowship, and you will build your network in this way, ultimately having a chance of matching in the competitive.
Yes, so even during the fellowship, we get the option to do electives in other divisions. So like when I was in cancer imaging, I did my elective in emergency and in abdominal imaging. And when I did my elective in abdominal imaging, I worked with the attendings there. Fortunately, I got like 2 research projects. And then I enrolled in those projects, and that is how I was able to work with them closely, and they came to know about my work ethics and everything. And then that is how I got a recommendation letter, a strong recommendation letter from one of the abdominal attendings, and everything worked out well. So
that's amazing. That's fantastic.
And also one more thing is that when we are applying to the fellowships, the competitive fellowships, they usually are applied through ERAS, which is Electronic Residency Application System. So if suppose I'm applying for the July 2026 cycle, I will apply for the fellowship. Like if I want to join the fellowship in July 2026, I'll be applying it. I'll be applying for that spot in July 2024. So you have like 2 cycles, the July cycle and the December cycle for the fellowship.
Oh, I see.
Yes. So the competitive fellowships usually go via ERAS, and they are applied to like 2 years to 1.5 years in advance.
Wow.
The less competitive ones, you can apply within 1 year or 6 months and still match those programs.
Very good.
Very rarely you may actually match, the competitive fellowship, provided that there is a vacancy, an urgent vacancy, and they want to fill in. In that case, one might get lucky. And some of my co-fellows, they've really gotten lucky that they got their first fellowship as a neuroimaging fellowship.
Wow. You mentioned that, but I've been involved in cardiac imaging for 5 years now, 2 years as a fellow and 3 years as an attendee. And I've seen it multiple times where positions just open up like that.
Exactly.
And then being ready and just having the ECFMG certification, having passed your USMLEs, and being ready to go, I think is a great opportunity to get in, because these positions open up. Like there was a circumstance where one of the one of the fellows who had matched, and then she took another position. So these are opportunities that open up, and if you're ready, you could potentially join.
Exactly. So, like, if you are ready, with all the ECFMG certification, step 3 and everything, if your paperwork is done, and if the position is there, they'll directly take you. Yeah.
Yeah, I know one of the fellows who trained with us, he got a call. He was ready, and he got a call saying, "Hey, are you interested?" And I think like a couple of months later, 1 or 2 months later, he was starting the program. I think it's just, things can move super fast.
Yeah. And also, like, one more thing about the alternate pathway is that most of the times a candidate is able to secure all the 4 years, at the same institute. But it happens sometimes that the fellowships are already filled in, and one is unable to find the subsequent year.
What do you do then?
Yeah, exactly. So in that case, there are like couple of options available. One can do a research year if that's available. If that is not available, then one might have to like switch the institute and do the 4 year from
Start
the
over.
scratch, or just like leave the institute for 1 year and then come back and do and complete the 4 years. And also, like, one more thing is that until you get all the 4 years, there is a slight uncertainty involved. But that is how the USMLE journey is. One has to like embrace the uncertainty. And one good point that I would like to share with you all was that, like, I had a co-fellow during my first year. And he was unfortunately unable to get a second year as a fellow.
Really?
So because of that, he was actually looking for alternative, institutes which were willing to offer the 4 year pathway. And he did get like a couple of offers for the fellowship, but he got selected as an attending for all 4 years in an institute in Texas.
Wow.
And he did a non-ACGME fellowship. So that is also possible, So it's like I know of colleagues who have done 1 year and 2 years of fellowship and have directly become an attending.
Wow.
So that is also an option. So one always have to keep looking, because USA is a land of opportunities. You just need to be like, excited, motivated, keep knocking the doors, send applications. Like before coming to the Brigham, I sent over 800 applications to different programs all over the US. So yeah, you just have to be like positive, optimistic, and it will work out in the end, Yeah.
That's amazing.
Yeah.
The resilience that it requires, not only to do the alternative pathway, but for many of us coming from another country and just making our way up and going through these hurdles. I mean, it's no different than other areas too, to be honest. Like my wife right now is in law school, and it's tough too. But yeah, to be an IMG, an international medical graduate, and be successful here in the US, there's a lot of uncertainties. I love what you said. You said embrace the uncertainty.
Yeah.
That's a good way of putting it. Mm-hmm. And that's a really great option too. I mean, can you imagine you've done residency in your country, and then you come here, you do 1 year of fellowship, and then you finish the rest as an attending. Making an attending salary.
Exactly.
Yeah. So just so you guys have a clear understanding of what that means. It means going from a salary of $70,000 a year, maybe as a fellow, to $500,000 a year as a radiology attending. And it could vary a lot, but radiologists do pretty well. So you get a huge jump in salary without having to finish the 3 years, the 4 years. I actually know of people that were recruited from other countries. Someone here, I know of a program in Texas that did this. They were so desperate for great radiologists that they went into Brazil and they found a great radiologist there and said, "Come here and we'll get you as an attending in our program." There won't be enough. There won't be radiologists in other places because they're all coming here. The United States needs a lot of good radiologists.
In fact, there is like so much shortage that ACR, the American College of Radiology, it's in the pipeline. It's not like consolidated, but they're thinking of allowing the physician assistants to read some of the basic studies like radiographs and like normal scans, so that the volumes are taken care of. So
Wow. Yeah, I can speak to that because I've been doing cardiac imaging for 5 years, cardiac CT for 5 years. And when I started this at our center, we used to do like about 10 a day, and now we're doing 30 to 40 a day.
yeah,
It's gone up 300%
exactly.
in 5 years.
Yes.
It's massive. And how have you liked fellowship so far in the United States?
The fellowship is like really good. The first change that I saw was that in India, the medical records are still handwritten. Over here, we have like electronic records, so that was like a major jump. The other jump was having access to PACS. In India, not most of the hospitals don't have PACS.
PACS is
So,
where the images are
yeah,
stored
where
and
the
viewed.
images are stored and you can access them. So the access to PACS was like a big jump, and also the advantage of having the prior scans. In back in my country, we still because we don't have like PACS. Most of the patients, they carry plain films
Wow.
of the CT scan and
Wow.
stuff, which gets degraded over the years and sometimes even lost. So we lose that ability to do comparison and see the temporal evolution of lesions. But that was the biggest advantage, to see how the lesions can evolve in response to treatment over the span of weeks to months. And that really enhanced the quality of the report. So that was like really good. And also a dictation software which we use. So in India, most of the places it's like typed. We have a typist and stuff. So that was also like that. That again, it really enhanced our efficiency. So that was like really good. Yeah.
Was it easy for you to adapt to dictating?
Yes, it was like super easy. Like we had like an IT session for 1 hour, and after that we just started dictating, and within like maybe a day or two, it was just like natural instinct for me.
And it's
So-
impressive how well it works. I
Yeah.
was shocked when I
Yes.
saw it the first time. What about in terms of volume? I mean, obviously, I imagine that in India volumes are also really high.
Yeah.
Over here, the same. Were they comparable, or was it a lot more there, a lot more here?
Yeah, so that is again a very good question. So the volumes in India are definitely much more high.
Wow.
So when we are doing like high volumes, at a fast speed, obviously the sensitivity gets affected to some extent. I like it over here, like we give like enough time to each patient, and the impetus is more on quality than on the quantity. So that is again like very good, and never have I experienced pressured to be fast or do more. It's like you take your time but give your best. So
Yeah.
I like that kind of work more than when you have like pressure of doing like these many scans in a day. So in terms of like numbers, I would say in India I would be reading like between 70 to 80 studies a day.
Wow.
But over
CTs?
here,
CT scans?
yeah, it was including everything. So
Yeah.
I used to like in my employment before moving to US, I used to read between 25 to 30 MRIs,
Wow.
about 15 to 20 CT scans, and about 15 to 20 ultrasounds.
That's crazy.
And I don't have count on how many radiographs I used to read.
Wow.
So that was like my regular work day. But over here, like on an average day, I read between 25 and 30 scans, and I'm very happy, yeah, no pressure. And also my working hours were like much longer
Can imagine.
back in India, but over here the working hours are much better.
Or did you work as an attending in India, or were you just a resident there?
So I completed my residency in 2018. Then I did 1 year of senior residency, and from 2019 to 2023, for 4 years I was in attending.
Nice. Very good. Very good. What motivated you to come to the US, Javed?
Yeah, so that is a very good question. There are like multiple reasons. So firstly, like many of my batchmates from medical school, they moved to the US, and I was in touch with them, and they gave me like really good reviews of the residency and fellowship training programs here. So that was one. Some of my immediate seniors, they had moved to the US. I was in touch with them. they gave me good reviews. And also I completed my residency at the age of 26. I had a lot of fuel left, a lot of fire in me to do something big. I and also like most of my medical education, residency, everything happened in the city of Mumbai. I think it was very important for me to like go out and out of my comfort zone, so that I get like a more holistic development, and also to see what the world has to offer. And US was like one of the destinations which I thought would satiate my desire. And also in the long term, I thought that I was doing general radiology mostly in India, and I realized that I want to do more like specialized kind of practice and not to do like everything. Because once we do like specialized practice, only then I'm able to give like excellent care to the patient. I cannot remember all the ligaments and all the nerves together at the same time. So either I have to like pick my thing and then become excellent at it, and I think that was an option available here. So these were like multiple factors which kind of like motivated me to come here.
It's great to hear you say that about and the perspective of someone who's practiced radiology elsewhere, not only as a resident but as an attendee, and then came to the U.S. Some things that you said, even like comparing to prior imaging, we take it for granted here.
Yeah.
Like I compared an aorta today with a chronic dissection and measured the size. It took me like a second to pull up the prior imaging. And in other countries, people are bringing their films and stuff.
Exactly, and also like the immune checkpoint inhibitors that we give to the patients, the molecular targeted therapies that we give to the patient. Sometimes the change of the is in the order of millimeters. So unless and until we have the priors and we are doing like due diligent measurements, only then we'll be able to see appreciable change or not. And that like really has an impact on management, because if we say that the disease is progressing, they'll change the molecular targeted therapy. And in my previous fellowship, I did not even know which medications they were using, because it was an alphanumeric code. It was an experimental drug. So we actually used to like Google it, what this actually means. So I like, how the system is over here. So we have Brigham Women's Hospital, Dana-Farber, Harvard Medical School, and then we have Massachusetts College of Pharmacy, and then we have the research labs. So it's like, the Longwood Medical Area. It in itself is like a whole kind of, the pharmacy lab is there, the research lab is there, and then you have, its application in clinical practice in the hospitals. So it was like very motivating, and very exciting to see this, happening in front of our eyes.
It's a privilege.
Yeah.
It's a privilege. Like I go to work every day, and it's
the whole
can't believe I'm here.
Yeah, the whole ecosystem is like super awesome.
If you don't mind, let's talk a little bit about like your background in terms of growing up in Mumbai, India, because you've shared this with me before, and I think that having the challenges and being exposed to hardship growing up, I think it really builds into us this resilience that allows you to get into a competitive medical school in India like you did, and then go through really long hours working as a resident, and then finish that and look for the next challenge and come to the United States and embrace uncertainty like you said. Do you agree? Do you feel, share with us a little bit about your background, and then also answer whether you think that, being exposed to these difficulties growing up were important in your career?
Yeah. So like a little bit about me is that I was born and brought up in the city of Mumbai, and both my parents never got the opportunity to get like formal education because of the socioeconomic situation. But they made sure that, me and my siblings, they get the opportunity. And also like as a child, I was, my speech milestone was delayed. And even when I started speaking, I had a lot of stuttering and stammering, which was language fluency disorder, which kind of like haunted the first half of my life, So it also came with a lot of bullying in the, in schools. So that like kind of like made my personality to be more introverted. And not only that, like I obviously wanted my bit of social interaction. So because I was not able to make friends, I kind of like made books my friends, So that was like something which was really good. So I'm like really thankful to everyone who bullied me because I fell in love with books. I fell in love with authors, and I'm in love with them still today. I still hold like every book which I read till date. It is with me in my belonging. They're
Wow.
like my closest friends. I never. My parents tell me that you have all this book pile, but I never give it away because they are my closest friends. Um, so yeah, so that was one thing. And also because my parents they gave me like full liberty and full freedom to do whatever I wanted to do, and they always believed in me, and because they believed in me, I felt like I could conquer anything. So that was also like something which was good. I was the first person from my family to graduate, postgraduate, double postgraduate, and then come to a foreign country for higher education. Obviously, this took like many years, like slowly, but it worked out well. And I'm very grateful for the privileges that I have got. Um, as a child during my upbringing, and I'm very thankful for the opportunities that I've got. I've met, fortunately, like throughout my life, I have been blessed with peers who are very motivated, very ambitious, and not only that, I was also blessed with teachers who were so passionate about what they did. So like I have been very lucky and very fortunate from that aspect. And obviously, I cannot thank the city of Mumbai. Like I've learned a lot from them. The whole city, the vibes. It's like super good, and yeah.
It's a beautiful story. Congratulations, my
Yeah,
friend. I'm
thank you.
so proud of what you've accomplished so far.
Yeah,
I'm
thank you.
sure your parents are too, your whole family.
Thank you.
And like I said, I think that hardship and the difficulties growing up, and even you said it motivated you to read more. I think it's a big part of our success.
Yeah.
In my case, it's one generation up, in the sense that my dad grew up very poor.
Hmm.
And then he was orphaned from his dad. He lost his dad very early on, so he had to work really hard. And he was poor, and but then similar to you, really pushed my sister and I to study, and like there were no excuses. Like you had to get things
Yes.
done. Like you said, really believed in me and my sister, and just like pushed us really hard. And ultimately, great things happened in my
Yes.
career too, like in yours. It's a beautiful,
So-
beautiful thing.
Glad.
And have they come to visit? Has your family come in Boston here?
No, not yet, but I plan to, bring them within the couple of years. Yeah.
Yeah. No, I'm sure
I
they'd
want to
be.
show them the whole world.
Of course, yeah. It'll be great. The whole cycle.
Yeah.
Them pushing you forward, and now you bringing them here. It's gonna be great.
Yeah.
And what comes next in terms of your fellowships? You said that you've done cancer imaging, and now you're doing cardiovascular imaging. You still have two more,
Yeah.
unless they fetch you for a job earlier, like you were saying.
Yeah. So for next year, I'm doing abdominal imaging and intervention.
That's great.
Yeah.
And intervention.
Yeah, abdominal imaging and intervention. The intervention is like cross-sectional intervention, more like biopsies, drainages,
Yeah.
ablations.
Still.
Yeah. And for my fourth year, I have applied through the ERAS, and I'm waiting for the match day in June.
Okay, good. So abdominal is pretty competitive fellowship.
Abdomen is a very competitive fellowship. In fact, the abdominal fellowship in Brigham and Women's is the biggest abdominal fellowship in the whole of US.
Really?
Yeah, and not only that, the abdominal imaging fellowship alone is bigger than the residency programs of many hospitals.
Wow.
So it's like a big program, and the attendings are like really passionate, very motivated. I've had the pleasure to work with them during my cancer imaging fellowship, as well as during my elective in abdomen. In fact, 2 weeks from now, I'm again going back to abdomen to do elective in intervention. So
You're going to forget all about us in cardiac imaging, cardiovascular imaging.
no, that's not the thing. Non-invasive cardiovascular imaging has been, the attendings are like equally good. The best part about the non-invasive cardiovascular imaging fellowship is that we have radiologists and cardiologists
Yeah.
attendings working side by side. And, we learn a lot of cardiology from our cardiology attendings and fellows. And likewise, there is like so much exchange of knowledge. And I think this is a unique program where we have this kind of combination. And we are like really pushing the horizons and, all these advanced rare diseases which were like not even diagnosed. Like we have like ICI myocarditis, we see like almost every week.
Yeah.
But previously, they were not there. So.
Yeah, again, what I'm going to say here, it's important to draw a line. I don't speak on behalf of the program, but I got to say, as an attending in the program, and again, I'm not speaking on behalf of the program, it's such an amazing place. Because as Javed said, such an unique environment where you have, in the same room, you have like nuclear cardiology, you have cardiac CT, cardiac MRI, and vascular imaging. And the cardiac imaging is staffed by radiologists and cardiologists. And that's actually a huge advantage. You get to learn from both radiology and cardiology. A lot of other places in the country, there's intrigue. There's like dispute between cardiology and radiology. But over here, it's pretty collaborative. And the reason why I say all of this is because I know there are probably many radiologists or future radiologists listening. And when you apply for your alternative pathway here in the United States, make sure to consider Boston as your home because it's a really great program. I invite you guys all to apply to our program.
Yes, and Boston is a great city. It has like a lot of positive vibes and so many activities.
Especially now after the end of winter.
Yeah, end of winter, yeah.
Yeah, we're recording this in early March, so it's the winter's brutal. It's not Mumbai is nothing like this, I hope.
Yeah, it's not like this. It's more like a temperate kind of a climate, more close to the equator.
Yeah. Yeah, like in Brazil where I'm from, it's like there are two seasons, the summer and like the even warmer season. Like or another way to say it's like warm and dry and warm and wet. It's all it's like 90 to 100 degree weather the whole time.
And one more interesting thing is that like I have lived in Mumbai, I have lived in Bengal, and I have lived in Boston. And coincidentally, all these were like, under the British colony at some point in time. And the infrastructure, the Victorian architecture was common in all these three places.
Nice.
So that was also something which was like
Nice.
common throughout, yeah.
Very good. Very good. Well, Javed, it's been great having you here on the show on MetaCast. Your story is really inspiring. I thank you for sharing about the alternative pathway. Where can people find more information about this? Would the American College of Radiology be the go-to place?
So the American Board of Radiology has the detailed, layout of, what you need to do in order to be eligible for the alternate pathway. And usually how it works is that you secure all the 4 years of fellowship, and then you submit the application to the ABR.
Oh, when you're done?
Yeah, so when you have all the 4 years secured, then you submit the application to the ABR.
Okay.
So the first 1 to 2 years, you are just in touch with your program, with your hospital. Once you have the 4 years secured, then you submit the application to the ABR. So it's not like you are approaching the ABR first. You are approaching the hospital first, securing the 4 years of training first, and then you are submitting the application to ABR.
Okay, very good. Oh, I remember something I wanted to ask you is in some programs, when you match for the first one, you already match for the 4, right? I know that there are some places where you can apply for all the 4 at once.
That is also a very good question. So there are some programs which offer you more than 1 year of fellowship, to begin with. There are very few programs who will give you like all the 4 years. Most of the fellowships, they give you 1 year at a time. They invite you, they see your work, and then if
they decide.
Then they decide. So it's like if you're hardworking enough, if you're efficient enough, most places you will get the subsequent year. Unless and until the program is already filled up, like happened to one of my fellows. Yeah.
Got it. No, that's good. That's good to know. So, guys, make sure you check out more information about the alternative pathway. It opens up an important dilemma for people who are finishing medical school and considering doing residency in the United States and they like radiology, which is, do I try radiology residency in the United States, which is really, really competitive, or do I stay in my home country for residency, probably cheaper, easier, quicker, and then apply for the alternative pathway. It's a tough dilemma for people
Yes.
who are in medical school and are interested
Yes.
in radiology.
Yes. One of my seniors from India, he did 1 year of fellowship, and then because he was unable to secure the 4 year, he actually, he did not want to deal with the uncertainty. So after the fellowship, he did like a repeat of the residency.
Oh,
So
he went
did
back to residency.
So he did a radiology residency. So like there are like n number of things of reaching to the same destiny through different paths.
Yeah.
So, but yeah, you can choose any path which works for you.
Yeah, but if you're already in residency, I think you have to, and you want to come to the United States, just go ahead and finish your residency and then apply to the alternative pathway.
Yeah, and also one more thing is that most of the fellowships, like when you apply for the fellowship, they expect you to clear step 3 before you apply. So, like unlike residency, even if you have cleared like step 2 and ECFMG certified, that's okay for application for residency. But if you're applying for a fellowship, then you need to clear step 3 well in advance. Yeah.
Okay. When you apply, I'll finish with this question. When you apply for the alternative pathway, what are the most important components of the application? Because we know that when you're applying for residency in radiology and internal medicine and surgery, you need really high scores. They're super competitive. You need to have a lot of research. You need to have done good rotations, get letters of recommendation. What are the two most important components when you apply for the alternative pathway, especially for that first one, before people actually have a chance to get to know you?
Okay, so if I understood your question correctly, you're asking me that what all documents we submit for application, or
But like more than that, one step further, which is what are the most important elements? Like what makes you a competitive applicant for that first fellowship?
Got it. So, the thing is that having done residency and having post-residency experience, for a couple of years, be it in an academic place or a private, in private practice. So that is one thing, like having volume, like good volume of experience. Like in my case, I had like 9 years of experience. So then the other thing is having good scores. And the third, I would say, is having publications.
Publications. Mm-hmm. Oh, it comes down to publications, guys. Yeah. Make sure you join the Meta-Analysis Academy. Just a parenthesis here. Our students in radiology have been super successful. Like we've had students in the Meta-Analysis Academy who've published in abdominal radiology, European radiology, who've presented, in RSNA multiple times. So if you want to learn how to publish in radiology and become competitive applicant, join the waitlist for the Meta-Analysis Academy. Javed, thank you so much. This was such an inspiring story. Thank you for sharing it. Thank you for bringing these insights into someone who's been successful in the journey, almost halfway to getting your 4 years complete. Yes. So thank you for sharing. A lot of people are going to be inspired by you. Just leave them a final word of advice, for someone who's listening in India, in Pakistan, in Brazil, and they're interested in doing the alternative pathway. What advice would you have for them?
Yeah, sure. Thank you so much, Dr. Cardoso, for inviting me here. And my message is there is USMLE journey is pretty long. So we always have this, this tendency to do analysis, and over-analysis leads to paralysis. So rather than, focusing on the end goal, just focus on the next step. So, just focus on one step at a time, step 1, step 2, CK, OET, step 3, then application. So just focus on one step at a time, because what I've seen is that, people who approach me, they often have a lot of questions. But the thing is that they haven't even, taken the first step. So it's better to take the first step. And then once you take the first step, rest of the steps become a lot more easier.
You gain momentum.
Yeah, exactly. So that is it. If it's a long journey, but it's definitely worth it.
Yeah. And then Javed, last question is, I always like to ask people about their hobbies. I mean, what do you do when you're not reporting 30, 35 CTs a day? You already mentioned reading, that you enjoy reading. What else do you like to do?
So a newfound hobby for me is cooking.
Really?
Yeah, so I like cooking Indian dishes. So nice. That is one thing. And the other thing is, spending time with friends, going out, checking out different restaurants.
Nice.
And, my best friends are my books, so I like reading, So I just like read random books. And
If you have any books you recommend to the audience.
so one book which I like I'm very close to is The Count of Monte Cristo, which it was one of the first novels which I read. And the thing which is interesting is that the hero, he comes back, despite of all the challenges, he overcomes everything.
Resilience.
Yeah, and he comes back. So that is one book which I would recommend. The other book which I'm currently reading is The Silent Patient, which is again a very good read.
Yeah, good, awesome. Javed, thank you so much for joining. It's been great to have you. If you're watching MetaCast for the first time, don't forget to check out our other episodes. I've been honored with receiving fantastic guests here like Javed and others. Make sure you check those out. Subscribe, hit the like button here, and then also join the waitlist of the Meta-Analysis Academy so you can learn how to do impactful research with autonomy. We'll teach you methods, statistics, and writing of systematic reviews and meta-analysis so you can advance your career. Great to have you here. Make sure you also check out our social media, other social media like Instagram and X. And Javed, thank you again one more time.
Thank you, Dr. Cardos.